Hi, I'm Olivia Bontempo with WCAT, coming to you from the new Hawkins Hall on Westminster's campus. As you can tell, I'm wearing a mask, which is one of the many protocols Westminster has implemented to ensure in-person learning to almost 2,000 students. Just over a year ago, Westminster announced the 2-week virtual learning period in response to the COVID-19 pandemic. The 2 weeks turned into the rest of the spring semester on Zoom. While virtual learning was successful, Westminster made it a priority to get students back on campus by the fall. WCAT spoke with Tony Boyd and Jim Justice, the co-chairs of the COVID support team, to hear details about the past year and the difficult decisions the team has had to make to keep the Westminster community safe. With weekly testing, masks, and temperature checks, the Westminster experience has changed considerably from the past school year to this one. One thing that hasn't changed is the resilience of the Westminster community.
It's incredible what has happened in every corner of the school. It's really stunning. I mean, it's nothing short of amazing. And it's not miraculous. It's a function of an incredible amount of hard work and dedication on the part of the adults and on the part of students too.
After finishing the 2019-2020 school year virtually, Westminster did open their annual summer camp to in-person participation. The camp, with limited numbers, served as a pilot program for the COVID protocols that Westminster would implement for the return to in-person learning in the fall.
You saw summer camp jump right in and say, we can do these protocols, we can make this happen. We didn't have any cases. It was very successful, and parents were desperate for their children to have relationships.
After the success of the summer camp pilot, Westminster began developing plans to facilitate a safe and engaging return to campus. The Westminster COVID support team recognized contact tracing and testing as two necessary components to get students back and limit transmission on campus.
We started August with individual PCRs out in Kentfield parking lot. We did another round of individual PCRs here on campus. And shortly after that, we found our vendor for the pooled sample PCRs, which has been really, I think, a successful program. Gives us the data we need to make decisions and keep everyone on campus learning.
After identifying a testing provider, Westminster began pool testing students on a weekly basis.
Testing does a lot for us. The first thing it does is it gets needles out of a haystack. One of the things that's insidious about this virus is the number of people who are asymptomatic. So when we test, we can get asymptomatic people, those needles, out of the haystack, but we're also, because it's pooled surveillance testing, what we're doing is we're assessing transmission. So when we test the entire middle school at one time and we get those results back, we know exactly who in the middle school has it. So we're looking at it and saying, are you in Mrs. So-and-so's homeroom? Are you guys on the basketball team together? Has the virus spread?
With over 50,000 tests so far and an average of 2,500 administered weekly, testing is no easy feat.
We're roughly 1,896 kids and somewhere on the order of 500 full and part-time employees that we're testing every week. So you're thinking roughly 2,500 tests and vials every week. There is a full-time testing coordinator and database manager, but we're all really pitching in here to make that happen. And then what you don't see on the backside is what happens when we get results, and our nurses across all 3 divisions are contact tracing. The deans in the divisions are helping us trace down kids and make sure we're staying safe. And so it's really a team effort.
Testing identifies positive students before they can transmit the virus, while allowing negative students to remain in person. Once Westminster receives the test results, the COVID support team begins work on isolating positive cases and contact tracing.
We bring them all back in here, we catalog them all, we pack them up, and we ship them to New York. They land the next morning They start processing the next morning, and then I get the results at 1:30 in the morning. And so I start looking at the results, and then I call Mr. Justice about 4:30, and we start working the results, and then we get in here and work the results all day and manage the confirmatory testing.
Keeping everyone safe and on campus is a community effort. Testing weekly allows for those who test negative to remain in person with confidence that they do not have the virus.
About 57% of our positive cases are identified here at school. When we contact trace, what we find, by and large, our positive cases are happening at social occasions outside school. Half of the other cases, about 25%, are cases that convert in quarantine. So that means we've quarantined you because you're a close contact, and now you've converted to positive. Those are big wins for us in making data-driven decisions, because they tell us we stop the virus at that point. And that's what we want to do, is stop it before it spreads. The rest of our positives come from people who self-report, which is incredibly important. Families and students who say, I don't feel well today, I'm not coming in, and I'm going to go get tested, and they test positive. They are helping our community stay here.
Testing is just one of the many aspects implemented into Westminster's COVID response. Other precautions include masks, social distancing, packaged lunches, and disinfecting buildings throughout the day. Westminster continues to learn and adapt as new research emerges. One protocol that has changed throughout the year is the lunchroom seating.
So one of the questions that's asked is about lunch. How can you go from 2 people at a table to 4 people at a table? Because the data told us that we could take that risk. And because we can test and assess that risk every week, we're seeing that as long as you're at the table as far apart as you can, we're not seeing people with the virus transmitted to others in that situation.
Another change to COVID protocols took place in athletics. The COVID support team was able to change the quarantine guidelines for athletes based on a study conducted with the varsity girls basketball team. The team piloted wearable proximity trackers, which collected data that showed how close each athlete was to each other and for how long. The results showed that if an athlete were to test positive, the entire team does not have to quarantine.
We put them on their shoes because we really wanted to know how close and for how long are people in a basketball game. And we found some really surprising results. People don't encounter each other during a game for that long of a period, where what we've been seeing in other schools is if you have one positive basketball player, the whole team quarantines. What we did find, though, is they spend a lot of time really close together before the game and after the game. So that's an example of how we can get data and adjust our protocols to maximize the student experience.
Changes like these were created to allow for a safe but engaging environment. Westminster continues to stay on top of the latest information regarding the pandemic to ensure students can stay in person.
We're not done. We are always learning. We learn every day, and we adjust every day. The COVID support team meets every single day for at least an hour, and then we're on the phone all night with each other in contact tracing. But we discuss every individual student who has to be quarantined or is positive, so we can learn from it and we can help that family.
Rear Admiral and Westminster alum Dr. Stephen C. Redd helped advise the COVID support team regarding Westminster's return to campus in the fall after his retirement from the CDC. I spoke with Dr. Redd to hear his thoughts on the response to the pandemic.
A lot of what I did was provide affirmation for what the plans were, and especially the testing that was being implemented, which wasn't part of the official guidance that any schools or CDC or the federal government was recommending. But I think that the school used the testing really wisely, balancing the cost of the testing, the frequency of the testing, and using those results to plan what the next steps were, and kind of continued to confirm that in-school education was safe, both for students, for their families, and for the faculty and staff.
While Westminster's COVID response has had its highs and lows over the past year, the COVID support team believes the effort won't be considered successful until the virus has been defeated.
Are we successful? We will be successful when we defeat this enemy. That's when we'll be ultimately successful. We will be successful if we can help other people learn with our data. We will be successful if we can all commit to having a strong finish to the year. Every time that we exclude a family, a student, or a faculty member from participating, we feel unsuccessful.
Westminster has coordinated vaccines for all faculty, staff, and students over the age of 16, which will allow for Westminster's annual events to take place with a sense of normalcy. We are thankful for the school nurses and the members of the COVID support team who work day and night to contact trace, administer tests, notify families, and keep our community safe. We are grateful for the faculty and staff who continue to improve the Westminster experience every day. And finally, we thank the Westminster community for their resilience during these challenging times. We are stronger together.